So my problem started around 4 years ago, my sophomore year, playing field hockey in college. I was diagnosed with compartment syndrome and had to get 2 surgeries, which unfortunately did not fix anything, which ultimately led me to make the decision to quit before my senior year.
A compartment is the region of the body that contains muscles, blood vessels, and nerves, and it's surrounded by bones, ligaments, and fascia. In compartment syndrome, the pressure within the compartment increases. Because the fascia surrounding the compartment is fairly inflexible, the swelling is directed inwards, and this can lead to pain, tingling, in severe cases weakness, that can potentially lead to long-term muscle or nerve damage. In Taylor's case, she had chronic exertional compartment syndrome, which is fairly rare, but when it is found, frequently seen in athletes during their sport, the cause of swelling is largely unknown.
So before treatment started, I wasn't able to go for runs or go for long walks without experiencing symptoms, which really discouraged me, as at 22 years old I would hope that I would be able to stay active and healthy. Playing sports my whole life, I always wanted to be able to just continue staying fit after college, playing field hockey in college, and I wasn't able to do that without experiencing symptoms or feeling that discouragement.
The muscles in the back of Taylor's legs were unhealthy, as evidenced by limited range of motion and severe tension with this ankle dorsiflexion test. Unhealthy muscles can't lengthen fully and are painful. I believe that it was these unhealthy muscles in the compartments of her legs that were swelling while she was running and causing her symptoms. Instead of just telling Taylor not to run, we wanted to help her meet her goal of getting back to running pain-free, and we used the Movement RX approach to help improve the health of her leg muscles. We used a specialized manual therapy, manual adhesion release, to generate tension that broke up fibrous adhesions within those muscles to improve their ability to lengthen. We also used instrument adhesion release on the muscles and fascia on the front and sides of her legs.
So I had tried other treatments before coming to Movement RX. I had been doing a lot of physical therapy. I also tried acupuncture and unfortunately never experienced any relief of symptoms from those treatments, and ultimately led me to just stop trying treatment until I came to Movement RX. So Movement RX differs from other treatments that I've tried for a couple different reasons. First, I really like how they do an intake form with you and do progress reports throughout your treatment to truly track your progress throughout treatment and make sure that you're getting the most out of the treatment. I also like how Dr. Alex and I were able to set both short-term and long-term goals, and what that meant to me. So just short-term goals between treatments, what I was able to do, but also a long-term goal of what I wanted out of treatment.
Initially, we saw Taylor for 8 treatment visits over 4 weeks, and during this time Taylor was instructed not to run in order to decrease the load on her muscles and allow them time to heal. The ankle dorsiflexion test improved from 2.5 inches on the right with moderate leg tension to 4.5 inches with no pain or tension. The test on the left began at 3.5 inches with moderate leg tension and ended at 5 inches on the left with no pain or tension. This, along with what I felt during our treatments, told us that the muscles were healthier and ready to be strengthened.
So I had the most positive experience with Movement RX, from the friendly staff and how they genuinely cared about your progress and how you felt. I had the best experience. I truly saw relief and results in between sessions, so I was able to truly track it throughout, and ultimately I've felt the best I have felt in 4 years.
Taylor was extremely diligent with our movement prescription, which included strengthening exercises, and soon after, she was able to return to running. We started out slow, alternating running and walking for limited distances, and gradually increased each week that she was able to do it pain-free. We also continued to monitor her ankle tests and the health of her muscles over less frequent treatment visits. Once Taylor could meet her goal of running for 20 minutes without pain, and her tests maintained their maximum improvement and her muscles remained healthy, she was discharged from our care.
If someone was on the fence about coming into Movement RX, I would say that I would highly recommend coming in. From the friendly staff and how much everyone cares about your progress to actually seeing the results, I would highly recommend coming in.
If you or someone you know is suffering from chronic exertional compartment syndrome, know that there is hope to get back to having freedom from pain and get back to doing the things you love to do.